Dr. Beck, let's talk a little bit about sports injury. I mean, you're dealing a lot with muscles and with nerves and basically pain management when it comes to nerves and to muscles and to back pain, lower back pain, and lots of that stuff has to do with injury, be it personal injury from a car crash, or be it a kid or not so kid who gets hurt skiing or being in a judo class. What should people be aware of there, and what type of injuries do you treat?
Well, in addition to being a nerve specialist, we're really musculoskeletal specialists. We specialize in problems of the muscles, ligaments, and nerves of the body. And this encompasses or includes sports injuries. And I frequently see people, typically teenagers through adult, with sports injuries, particularly sprains, overuse injuries, throwing injuries, things of that nature. And those things typically respond quite well to rehabilitation techniques, which don't involve surgery.
Okay. So again, is that kind of like the way you do it when you do your back pain and neck pain and activities where you basically tell people to do the exact correct exercise to exercise a very specific muscle, which then offsets the pain and gets things back in shape, and also some medicines and some medicines which take the inflammation away and stuff like that.
Mm-hmm.
Same thing.
Yeah, let's take a hamstring injury, for example. Mm-hmm. This is a real common sports injury, and it results from a variety of factors. For example, many people have an imbalance in the strength between their hamstrings and their quadriceps muscles. They often have inflexibility or tightness in their hamstring muscles that leads to injury. And frequently, if you really like a certain sport, it can lead to recurrent injury. And so this is where we have to really focus in with, like I said, targeted exercises to, number one, treat the original injury, and then treat those imbalances and those tightnesses that are causing the recurrent injuries. And so there's two real goals from my standpoint when we're treating those type of injuries. And this is sort of the way we approach most sports problems, is that you're frequently looking at imbalances in strength and flexibility, and coupled with overuse or overactivity, this leads to injury. And this is something that, again, you have to really target in on what those imbalances are. Is it your quadriceps is too weak? Is your hamstring too tight? Before we can really give you the targeted exercise to really improve the problem and help prevent it in the future.
Yeah, right. Those hamstring injuries, they can hurt. I seem to have gotten them about 2-3 times so far in my life. Once with skiing, I remember, and a couple times doing taekwondo and kind of just wanting to jump, and next thing you know is it goes. Actually, one time we just on the road, sprinting with normal, suit and tie and playing and say, all right, let's sprint over there too. And next thing you know is you go bang, and oh my God, when those things hurt, they hurt for weeks.
Oh yeah, they're bad.
They're bad. It feels like something broke in there,
Oh yeah.
Yeah, and so what this is very important. What you said here is that they happen because of like an inequality in strength somewhere. So you literally push one too far when you really shouldn't, or it's too tight in the first place. And what you say is there are exercises which you can do, very specific, which kind of like fix that so that you don't always get it.
That's right. You have to get to the root cause of the problem. This is my philosophy basically in treating anything, is that you got to find out what's causing it. You just don't treat the symptoms. And this is what we have to do with sports injuries. What causes your problem? Is your ankle being turned repeatedly because your ankle muscles are weak? Are you getting tennis elbow because your gripping muscles are weak? Or is there some tightness there that needs to be affected or treated? And so we want to get to the root cause of the problem, and then using the rehabilitation approach, we can frequently treat sports injuries quite successfully.
Wonderful. Yeah, because I mean, if you're a sports person and whatever it is you do, even if it's just in the summer wanting to run on the beach and you get all kinds of things. Or, for instance, people are twisting their ankle frequently. Is that also such an imbalance where something in the body could be strengthened or loosened or whatever it may be?
Yeah, for example, if your ankles are twisting on a regular basis, the muscles that stabilize your ankle or keep it steady, frequently you may have some weakness there that needs to be addressed. Now, there's another thing called proprioception where you kind of know where your foot's at, your sense of balance that needs to be improved as well, because if you don't have good balance when you walk, you're going to step on your ankle the wrong way and you're going to re-injure it again. So we really work on strengthening and also on balance activities as well.
Mm-hmm. Wonderful. So overall, you're working on exercising the right muscle at the same time testing it, because you have all the testing equipment. You really know the muscles and the nerve. You do all those tests, which are very important to see whether something is wrong there, whether where a muscle is stuck. You have all from radioactive injections to all kinds of things you have, which you really laser precise can figure in. This is where the problem is, and then with exercise and with certain medicines and injections and with this, combination of that, you get things fixed.
That's right. We can very often affect things. So we'll treat the acute injury and then help you prevent future injuries. That's my goal.
And you're using, it looks to me like you're using definitely a combination of, let's say, physical therapy, chiropractic, but in addition, you have a very scientific testing, because after all, you're a highly qualified nerve specialist. And in addition, you also use medicine for short-term use as much as possible if needed to get rid of it. So basically, it's the best of both worlds, so to say.
Yeah, we use all the tools in our bag, and for me, it's doing state-of-the-art testing, whether that be nerve testing, musculoskeletal ultrasound, or MRI scans, and using practical things like injections, medications, anti-inflammatories, heat, cold, specific exercises, and if necessary, soft tissue mobilization and manual therapy as well. So we rely on a variety of techniques, and usually it's not just one technique that's going to get you better, but all the combination of things that we're doing that's going to get you back to playing the sport that you enjoy.
Or get out of whichever way you got your back pain or your neck pain or whatever it may be.
That's right.
Thank you very much, Dr. Beck. Pleasure talking to you.